Let's talk briefly about nutrition during pregnancy. Gaining too much or gaining too little can be a problem. These are the recommended weight gain for women during pregnancy. So when you look at this, you can see that it's dependent on how much you weighed before pregnancy as to the total amount of weight gain that should occur during the pregnancy. Gaining too much can result in hypertension and diabetes. If the woman develops diabetes, it can cause macrosomia, which can cause a difficult, longer labor and shoulder dystocia and fetal distress from cord compression. Gaining too little means that the baby may not develop properly, which increases morbidity and mortality and can also result in preterm labor. This is the normal pattern of weight gain for women in pregnancy. In the first trimester, you gain very little amount of weight, about 4 pounds, and then about 1 pound every week. The total weight gain is distributed throughout the body, in the breasts, the baby, the placenta, the uterus, the amniotic fluid, and the blood and fat storages. So when you look at weight gain, it's just not all baby. The nutritional needs increase throughout pregnancy and during lactation. This is the daily food intake guidelines, and if you look carefully at this diet, it's a pretty balanced, basic diet, healthy, and relatively easy to follow. There are government-funded programs to help women and children who need assistance with eating properly. And what they do is they provide supplemental foods, they have healthcare referrals, and they also provide nutritional education. The great thing about the GI tract during pregnancy is that it's much more efficient. It's better at extracting the nutrients that it needs. Remember, though, that you only need about 300 calories more per day during the pregnancy period, which is probably somewhere around 2,500 calories. There's the potential for nutritional deficiencies with calcium, folic acid, and zinc. So folic acid is a very important vitamin that you must take. It allows for proper red blood cell function and also for the production of DNA and RNA. And it's been found that folic acid supplementation helps to prevent neural tube birth defects such as spina bifida. These are the recommendations for folic acid supplementation, whether you're low risk or high risk. And these are foods that you should encourage women to eat because not only are they healthy, but they're high in folic acid. You want women to get 3 to 4 servings of calcium through dairy products and green leafy vegetables and salmon. Carbohydrates should be complex to give the woman energy. And omega-3 fatty acids can be obtained from salmon, flaxseed oil, and canola oil. Many women need iron supplementation during pregnancy because they have the physiologic anemia and do not have proper iron stores. So many women have iron deficiency anemia and need iron. Also, it's essential for the newborns to store iron in their livers for 4 to 6 months, and so they need that before supplementation starts at that time. There are foods to avoid during pregnancy. There is one bacteria called listeriosis. This is found in unpasteurized milk, hot dog, lunch meats, refrigerated pate and meat spreads, smoked seafoods, and raw seafood and eggs. These should not be eaten because they can cause miscarriage, stillbirth, and premature delivery. Foods high in mercury should also be avoided. So, in summary, eating a proper diet is essential for proper fetal growth. Supplementation with prenatal vitamins, iron, and folic acid is essential in trying to meet all the dietary requirements. There are definite parameters for weight gain in pregnancy. You only need about 300 more calories a day while you are pregnant. Try to follow a basic healthy diet. There are foods that you should avoid, and there are programs like WIC that can assist you in learning about how to eat right and helping you with buying the food to stay healthy.